When is the right time to fix your breast implants? Let's discuss. So I like to think of breast revision surgery as a risk-benefit analysis. We have to look at the benefits of the surgery and then the potential downsides or drawbacks of surgery, and then you put that together as an equation that either says, yes, we should do our revision surgery now, or maybe I should hold off. So let's first start with the benefits of your revision breast surgery. And the easiest way to think about that is separate them into I need surgery to fix a problem, or I just want surgery to fix a problem. I say there are 5 things that need surgery to fix. First, the implant is broken. Second, the implant is contaminated by bacteria or infected. 3, the implant is encased in abnormally thick scar tissue called CAPSULAR contracture that's causing pain. 4, very rare risks of certain types of cancers. And 5, this is somewhat controversial, but I'll throw it in here also, and that's breast implant illness or BII. So that's a list of the 5 things that need surgery to fix for your breast implants. But there's also a category of I want surgery to fix. And this is essentially everything else. And these are more of cosmetic desires. Implant size change, want to go bigger or smaller. The implants have moved. The breasts have moved. The nipples are in the wrong position. I don't like the feel, rippling, any of those things. And that's actually what drives most revision surgeries is the want category. And that's why it's really difficult for us to determine how long you'll have with your implants before you may want or need a revision surgery. Because most people are wanting their revision surgery for the want list. So that's a short list of the benefits of the surgery, but now we always have to consider the downsides or the drawbacks of having a revision surgery. And this one is fairly easy conceptually to think about. I call them the 3 C's, just makes it easy. First is the costs of the surgery, right? And this includes both financial, dollars spent, but also time spent in recovery. 2 is the consequences of your revision surgery. And this means it will actually depend on the type of surgery that you have, but let's do an example. Let's say we're thinking about removing our implants and either not replacing them or maybe trying to do a lift without another implant. Well, the consequences of that can be 1, we don't have enough volume on the chest that you would like to see. 2, if you don't do a lift, it may be a little bit on the droopy side. And 3, even if you do a lift, it may not have the shape that you want. Oftentimes, losing out on some upper pole fullness. So those are consequences, right? They're not really complications, which is our final C, right? Complications. Any revision surgery for breast implants has a much higher risk of complications like infection and wound healing problems. Whatever you can possibly think of, almost all of those risks for complications are higher with a revision case versus a first-time implant case. And so those have to be weighed into your risk-benefit analysis. Now we've discussed the risks and the benefits, and now it's time to put them together. And I think this is best done after you've had an exam and a discussion with your plastic surgeon. If you're interested in having a more detailed discussion with me about your revision surgery, I recommend going to our website at alamoplasticsurgery.com and scheduling your appointment today.